Hey y'all, welcome to the Team LocoFit Roundtable, hosted by me, Laurin Conlon, owner of Team LocoFit. Each week, I am joined by one of our coaches to dive headfirst into the nutrition, training, mindset, and coaching strategies we use with our clients. If you loved the show, please subscribe, leave us a review, tell a friend, you know the drill. And for more information about coaching, the programs we offer, and additional content, visit teamlocofit.com.
All right, and we are back once again with Racquel Frisella. I'm so excited for this podcast because we wanted to do another Q&A. The first time we recorded, we had so many questions sent in, and then I was like, all right, I know that I did not get to all of them last time, so let's do another Q&A, and I had so many great ones, so we're just going to get rolling right now. First, and this was a really unique question and something that I've thought about, and I was like, wow, maybe people don't know this. What is the order to apply products? So let's say, for example, for like the morning, you have a cleanser, you have a moisturizer, you have your SPF, you have your, like, where are we doing that? And then also with the acidic pads that we're using at night, how does all that play in?
Okay, great question. My first little tip that I always tell clients is sort of always keep in your mind clear to cloudy. So your products are going to start with your more clear products and end with your more cloudy. So that's going to be your SPFs at the end. If it's at night, your like acne spot treatments, that think that direction. But we'll start with AM routine first. So in the morning, you're going to start by cleansing if you need to. If you did your routine the night before and you wake up with a super clean face, you could actually skip that morning cleanse. So that's going to just depend on the person. If you're a real sweaty sleeper or more oily skin, you may kind of feel like you need that morning cleanse. So you're going to start with your cleanse. Then the next step is you're going to apply your hydrator. So whether that's your hydrating serum or your moisturizer, you're going to apply that. I always say, especially if it's a hydrating serum, put a few drops on, put it on, and then brush your teeth, do your hair, something giving it a few minutes to kind of just soak into the skin. So you can kind of distract yourself for a minute and then go ahead and apply your SPF last. If you layer them too quickly, sometimes you'll feel like you don't get complete absorption and products can almost like kind of pill on top of each other. So just making sure you're just giving it a few minutes in between. Nothing crazy, but just kind of giving things time to soak in before you put the next layer on. So keeping it simple, that's going to be your average morning routine. And then at night, when you're using acids and exfoliators and things like that, it's going to depend on how sensitive your skin is and how long you have been using the products. So if you are brand new to exfoliants and or if you have really sensitive skin, we're going to start you out more slowly. We're going to build a tolerance up. Your skin definitely goes through an adjustment period. I call it the purging phase, where you'll see some dry, dead, flaky skin. You'll actually see maybe an increase in breakouts. And that's because these products are actually picking up and pulling out all the junk out of the skin. We are trying to shed off the outer layer of dead skin cells. So these are actually good things. It just kind of sucks going through it. But your skin will get used to them. But with that being said, for the first few weeks, if you're new, I actually will have you hydrate on top of the pads or have you put serums on top of the pads. And then the ultimate goal is once your skin is adjusted, and for some of my super, super sensitive clients, they never stop putting moisturizer on top of pads. And so my point is it's going to be a little bit individualized depending on your skin type. But for the average person, the goal is you're going to use your exfoliant with nothing on top. You're going to put your exfoliating pad on and you're just going to go to sleep. When we put a little moisturizer on top of an exfoliant, like say you use retinol and then you moisturize on top, it does neutralize the acid just a little bit and it makes it just a tad weaker, which is not always a bad thing. Again, if you have sensitive skin, if your skin is super dry or compromised, if you're sensitive, if you're new, that's okay. We want you to actually use moisturizer to ease your skin in. The worst thing you can do is over exfoliate your skin and just like dry it out like crazy and then keep using it. You're just going to get yourself into like a vicious cycle. So less is more, easing in. So with that being said, depending on who you are, at night you're going to cleanse. You're going to apply your exfoliant, and then you're either going to put some moisturizer on top or you're going to skip it. And if you're like me, you're probably going to do a little bit of both. So most nights I go without moisturizer on top of my exfoliants, but if I am feeling dry or if I've been using exfoliants a lot of days in a row, I'll go ahead and throw some moisturizer on top of those pads. When it comes to serums, you can kind of play around with those. And I always tell my clients, your skin doesn't know what time it is. So your skin doesn't tell time. So there's no right or wrong when it comes to like, do you want to use vitamin C in day or night? It could honestly depend on the person. So you could do it both. And so when you're sticking a serum in there, you'll just do that underneath any other moisturizer you're using. So if you're using exfoliating acids, I recommend alternating nights. So like do your pad one night, the next night do some vitamin C and some moisturizer. Do your pad, then some vitamin C and moisturizer, and just kind of like alternate that way. You can also apply your vitamin C or your serums on top of the pads every once in a while too, if you just want to kind of mix that in. So it's going to depend on the person, but you're always going to do your exfoliating acid first and then any moisturizers on top. And then I always make my very last step the eye cream, and then you're just going to kind of tap that under the eye, around the crow's feet. You can take it onto your eyelid, up to your eyebrow. And then little trick, you can always use your eye cream on your lips too.
I didn't know that. Okay, well, that's good to know, because sometimes you get too much and then you're like, well,
what do I do with this? Yeah, I always rub it on my lips. The skin on our eyes and lips are both like super delicate and absorptive and sensitive. So it kind of can do the same thing for your lips.
see, I'm even learning on the podcast. This is amazing. All right, so filler for dark circles under the eyes. And then the second question for under eyes, which could be related, is how to tighten up bags under the eyes.
Yep, super popular. So we're talking what we call tear trough filler or under eye filler. And so there are really two different kinds of patients when it comes to under eye filler. You're going to have your patients who are just hollow underneath their eye and just have some emptiness. And that's really the best possible candidate for a tear trough filler, because we'll go in with filler and we'll just kind of fill up that depression, and really it'll kind of take away the hollowness and make you give you like instant rest. Then you have patients that are empty, but they also have a fat pad above it. And that's where the fat pad's actually sticking out.
So annoying.
It's super genetic. It's nothing you did. It's completely out of your hands. It's usually, if you look at like mom, dad, grandma, grandpa, somebody has that. And sadly, it does worsen as we age. So it's not fair, because like all the good fat goes away as we age, and then like the bad fat hangs around. So messed up. But that's why we have filler, because we can just blend these things out. So, that's something where as a provider, I really have to assess you. It really depends on the degree of the fat pad. The fat pad is basically like a little prolapsed or herniated fat. And so when it's mild and it's not sticking up too much, we can absolutely blend and sort of hide that with tear trough filler. When the fat pad reaches a certain height or a certain severity, then sometimes you no longer become a tear trough filler candidate, because then we would almost just be fixing one thing but creating another problem. It will just make you look puffy overall, and just honestly, it won't be a beautiful result. So tear trough filler is finicky, and just because your friend gets it doesn't mean you can. So that's where it's important to go to an experienced provider who's going to be able to look at your anatomy and tell you if you're a good candidate or not, and also to make sure that they're using a good product. So there's a lot of different fillers out there, and all the fillers that I use in practice are made of hyaluronic acid, which is a naturally occurring carbohydrate in our body. It is completely reversible, which is why I love to stick within the HA family. I do a super high volume of filler, and I always say it's not if, it's when you have a complication. I want to be able to reverse it. I want to be able to fix it. So reversible fillers, in my opinion, especially by your eye, are non-negotiable. I would not recommend permanent fillers by your eye. So just kind of paying attention to those things and asking those kind of questions when you go in to see, is this filler reversible? And also make sure you ask, do you have the reversal antidote? That's something I'm seeing more and more of now. This market is becoming more saturated. More people are wanting to inject. And I saw like a great post from one of the other injectors I follow on Instagram. And it was like, some things are really good on the side. Some fries, some sauce, maybe a couch on the side of the road. But it was like, your injector is not good on the side. Like, don't go to somebody who's just, maybe they're a wonderful ICU nurse, but they're just going to pick up and do some fillers on the side for fun. Like, you need to be especially when you're talking about your eye. or just anything. You want to be going to someone that does this day in and day out and knows the facial anatomy, knows how to handle complications, because again, it's not if, it's when, and how to reverse it and things like that. So that's where, you want to ask those kinds of questions. Like, do you have hyaluronidase, the reversal agent? And so then if you know that if there's a complication, that you can go back to that person and she can reverse the filler for you, or he. But that was the point of the person's post, was they had saw a patient in the office who came to them from another provider and with a really messed up under eye result. And she was like, why didn't you go back to your provider for this, and have them reverse it? And she's like, I did. And they said they didn't have reversal and really couldn't help me. And that is just so scary, because, when you're thinking of filler, it is a commodity and it is fun and it does get very glamorized, but it is important to remember that it is still a medical procedure and things can go wrong if someone doesn't know what they're doing. Worst possible scenario, there's things like vascular occlusion or blindness or things like that. So you just have to really make sure that, that it's not the filler, it's the hands that are injecting it, that they know what they're doing and things like that. And that people are, safety is always number one, and also patient satisfaction. So just making sure you are a candidate for something, especially like under eye filler.
Yeah, I think being able to tell somebody no is really powerful as the provider. And I mean, in our line of work, we do that all the time. People come to us and say, hey, I want to do this. Well, based on your history and where you're at right now, we can't help you with that goal. But here's what we can help you with. If we were just to say yes to everybody and like what they wanted to do, we would be doing a disservice. So the same thing with people in the, like in your field, if you were to say like, hey, you're the perfect candidate for this filler. And then in reality, then it looks 100 times worse. You're like, oh, sorry, I just wanted to make however much money.
Yep.
That's not good. I didn't even know there was permanent fillers. Like I always thought they could all be dissolved. So it's terrifying. So yeah, guys, definitely check that out, because things can go wrong, even if you go to somebody amazing. So making sure that you can reverse it is really key, which is a perfect segue to one of the most asked questions was about lips. Many questions about lips. And I would imagine that it's probably just like an uptick in the trend recently. Who knows? So what are some of your favorite fillers that you use? And then also, how much would you really recommend at once? Obviously there are that's all dependent on somebody's lip size, and I understand that. But even if somebody has really small lips and they want to take them very large, there's only so much at once. So what would you generally recommend at once, and what are your favorite ones?
I love lips. It's one of my favorite places to inject. And lips are also technical. So it definitely matters what your anatomy is. So there are so many different lip shapes out there. And so if you ever take the time to really look and kind of figure out what shape lips do you have, do you have more of an M-shaped lip? Do you have more of, a more prominent Cupid's bow, or you have more of a flat upper lip? So when I see a patient, I'm first assessing them and I'm like, okay, this person has, say an M-shaped lip and their lip kind of tucks underneath and it hides. And then when I kind of roll it out, I can see it's there. It just needs to be kind of pulled up. That's going to help me in my decision of what technique am I going to use and what product am I going to use. So some of my favorites are Juvederm. Restylane Kiss is really beautiful. I've been loving that. That came out, we've had it maybe a little over a year and a half now, but it's been used in Europe for a long time. So we've been watching that. It's a really beautiful filler. It's going to be a little bit more firm than Juvederm, but still very soft. So that's a really nice choice if you're someone who is wanting to see really good crisp definition in your lip borders. If you're wanting just more fullness and voluptuous volume, sometimes we'll use something a little thicker like a Juvederm Ultra Plus. But I'm always going to stick in there's a ton of different fillers, both within the Juvederm and the Restylane, and we have some newer fillers called RHA. Inside those portfolios, there's different kinds of fillers, and they're going to vary in terms of their thickness. So typically when we're talking lips and eyes, like we just were, we're thinking of things that are on the thinner side. You're usually not going to stick like a huge thick filler like Voluma in lips. There are instances where we will use that, and so it's not wrong, but it's just, an individual basis. But I would say on a daily basis, I'm using a ton of Juvederm and Restylane Kiss in lips right now. And I love them both. So lips are definitely a work in progress. If you have virgin lips and you're doing them for the first time, I'll never put more than one syringe in a sitting. So with lips, it is so important to build that foundation and to build your lip volume slowly over time. Your lips have a certain shape to them. And if you were to go just try to inject a ton of filler in them in one sitting, you can almost lose your lip shape and they can just just be kind of like sausages. We don't want that. We want really beautiful shaped, pretty lips.
We've all seen that.
And it's not a good look. My biggest thing patients say to me, and it's usually with lip filler, but I get it with all filler. 9 out of 10 people come in and they're like, I'm just so nervous. Like, I don't want to look weird, or I don't want to look overdone. That's everybody's fear. And so that's too where you need to do your research on your provider and just see like, what is their injection style? Also, what do they look like? If you walk in and like their lips walk in the room before they do, like, get ready, because you're going to get some big lips, girl. You got to think like that's what their sense of normal is. So, keeping those things in mind, you just have to like figure out what your style is, and, does your injector align with that? So I always tell my patients, I am more conservative, less is more natural, so, and within that, you can definitely go for fuller volume, but we always just want them to have pretty shape and basically just accentuate what you've already got and give you, your best possible lip. So it's going to be a little bit different for everybody, but I wouldn't recommend more than one syringe in a visit. And I also have my patients wait a few months in between. So I just had a girl yesterday, I did her lips, and she has definitely a thinner lip. And she was showing me some inspo pics, and her goal, she wants to get some pretty good volume going. So I was just explaining to her, okay, let's do one syringe today. And then I want you to come back in 2 or 3 months and we'll do another syringe, and we're going to slowly build you there over time.
Yeah. Cause too fast, it can just doesn't really, I feel like it just doesn't look as good. Like you said, it just kind of, you lose the lip shape, and then it could, and now it can always creep up, because that is a possibility. But I would say there's probably a higher chance of it when you do it really quick, right?
Absolutely. Yeah.
And that's when you have like, people have like filler up here. And now if you have one of the dissolvable ones, you can go and get it dissolved, which is great. But that's another reason to definitely not get permanent ones. Oh my God, I'm so horrified at the thought. Lip flip. A lot of people were asking about that as well, because I know that you talk about it, and there's just a lot more people talking about lip flip in general. So what is that? Is that in conjunction with fillers, or?
Yeah, you can do it in conjunction with your filler, or you can just do it standalone. So when you hear the little coin term lip flip, that is talking about Botox above the upper lip. So we have a muscle that runs around our lips. It's called your orbicularis oris. It's like a sphincter muscle. And when we relax the muscle, so Botox relaxes muscles. And when we use it in this area, we're kind of just doing doop, doop, like 2 little drops right above the lip. Usually I use about 4 units. And that's going to relax the muscle above your upper lip. So what does that do? 2 things. For my more mature clients, it's going to help reduce the smoker's lines, which 9 times out of 10, the person doesn't even smoke. So I kind of hate that term, but it's just what we call it. But you get that from excessive pursing. And again, can just be sort of a genetic thing. When the upper lip is a little more relaxed, it's going to inhibit you from pursing so tightly. So it'll help soften those little perioral lines. And then in both my younger and my more mature clients, everybody loves the little lip flip effect, which is the illusion of a fuller upper lip. So that just means that when you smile, your upper lip is going to look bigger. It's not actually putting volume into your lip, but because when you smile, typically your upper lip wants to kind of like tuck in and hide. And so when this upper lip is more relaxed, when you smile, that lip's going to kind of stay open and out and show more of your lip, so it looks fuller.
Yeah. And you don't have to do this when you're getting filler too. So most people are going to get filler. How often would you say? Now, not the person who you just talked about who wants to achieve high volume. So say you're happy. How frequently? Year and a half-ish, right?
Exactly. I usually tell people it's typically a once a year type thing. Filler in the lips, it does metabolize most quickly of all the facial areas, because we're talking, we're chewing, we just use our mouths a lot. So it does seem to go a little faster there. So usually it's about once a year. And even at a year, it will not be completely gone, which is a good thing. You still have a foundation in there, and you just need to kind of top them off. So for some, if you've been doing your lips for a few years, it sort of has a cumulative effect where you might find like, hey, I can go like a couple of years without even needing it, and you're still going to have filler in there.
But you could get the lip flip even if you're not getting filler, just to kind of give it a little bit extra.
You absolutely could. And I also see a lot of patients who are too nervous to do lip filler, and they just like need to ease themselves in. So they'll do the lip flip first, just to like try something before they end up, going for lip filler. And I always say that's like a nice little stepping stone. It's definitely not going to give you the same result as filler. What I often find is when people use it in that situation, they like it, but they're slightly underwhelmed and they're like, okay, I really want the lip filler. That was okay. But especially if you're somebody with a gummy smile, like if you smile and you show a ton of gums and that bothers you, the lip flip or Botox in the upper lip can help lower that down a little bit. And so for some people who have a very gummy smile, it can be very transformative and make them feel a lot more confident.
Yeah, I love adding that in whenever we do Botox, and it's not on the same frequency as getting the lip filler, but it definitely does just add a little bit. So going into that last question about lips was someone said, I burned through my filler in 3 weeks. So I think that there's kind of two parts to this. One, I think that the swelling wore off, right? Like that kind of initial swelling. So that's one thing I'd like you to talk on. And then also how we talked about some people just metabolize it faster, and then you do have to build it up. Like I know the first time I got it, I was like, did I get anything? Like it kind of just seemed like a little bit, but it wasn't that much. And it really wasn't until the second time, same with Botox, that I ever really notice, oh, okay, now there's actually something very different here. So just wanted you to speak on that a little bit. She said 3 weeks, she felt like she burned through it.
Yeah. So, I mean, I'd have to see her because she could be the anomaly and maybe for whatever reason that happened, but it's highly unlikely. And I do hear that a lot from clients. And what I always do, so before I will do any work on a client, I always take their before picture and have their baseline photo. And if they don't want their picture taken, then I can't treat them, because everybody needs to have a baseline, because that way you can refer back to it. So whether it's a complication or you just kind of want to, we forget. It's a slow, gradual change. So you honestly forget where you started. And I see it happen all the time, where I literally had this happen yesterday. Real cute lady came back and she's like, you did my lips in May. And she's like, I really loved them, but it's like, it's already all gone. I can't believe it. And she had a more thin lip. And my medical assistant already knows. She's like, it's there. I'm going to take the pictures. So what we do, first thing when somebody says that, we take their picture and then we pull it up in our system, and I pull up their very first before to where she was yesterday. Huge difference. She just completely forgot. Like it still was there and it was visibly notable. And then once I showed her, she's like, oh my gosh, I like forgot that my lips were that thin. Like you just forget. You really just forget. So 9 times out of 10, it's that. And they probably were a little more full at first too, because like Laurin said, you do have swelling that can last a couple of weeks. And maybe they do metabolize a little bit for some faster than others, but I guarantee not completely gone. And then it just depends where you started. If you were somebody who already had a pretty thin lip, like one session might not be that dramatic for you. 5 syringes of filler fit into 1 little teaspoon or 1 little ketchup packet. So when you're talking about 1 syringe, it's only 1/5 of a teaspoon. It's not a ton of product. So if you have a super thin lip and you're wanting to see a lot of change, you might need more than 1 session. But for the average person, honestly, 1 session once a year is golden.
So we had a lot of questions about acne, and we talked about this a little bit before we started recording, and you said that this has been coming up in your practice as well. So it was everything from acne to stress acne to hormonal acne, and there's a lot of confusion around here, and obviously like you're not going to speak to like the hormone side of it or the diet side of it or whatever, but just in general, what are some ways, especially with acne, I'm sure that that's like pretty straightforward in comparison to the other ones. What do you see that helps in practice, or any kind of trends that you guys notice with acne?
Yeah, I think it really depends on the kind of acne. And so there's inflamed and then there's non-inflamed acne. So if you're somebody who's dealing with some really chronic, cystic, just horribly inflamed acne, we're going to treat that with a completely different approach than somebody with non-inflamed acne. And that's where a professional can help tell you like what kind of acne you're dealing with. Because if it's non-inflamed acne, that's where we're going to bring in retinols. We're going to bring in a retinoid. We're going to bring in those exfoliating acids, and we're going to purge that acne out of there, and we're going to get you clear. We'll probably do some hydrofacials, maybe some chemical peels, and then just get you on some really good skincare at home. If you've got that more really chronic inflamed acne, the approach is going to be a lot more gentle. We don't want you on harsh exfoliating acids. I actually would not recommend those exfoliators. First, we're going to use like antibacterials and a really gentle, soothing method to kind of clear the acne. And then regardless, of which side you're on, we do really need to look at really where your forte lies, Laurin, and kind of lifestyle. Like, what's causing this? Is it diet related? Is it fitness related? Hormone related? Is it all kind of, correlated? And then you kind of have to figure out and start there what kind of lifestyle changes you can make. Are you like not washing your face? There's so many things. And so if we're not getting to the root of the problem, the acne will still happen. So I always tell clients, like, even once we get you on the good skincare, it doesn't mean you're never going to get a zit again, or you're never going to have a hormonal breakout again. Like, hormones are going to rear their head. You're going to get those breakouts, but the products are absolutely going to clear those breakouts faster and prevent them from happening as frequently, and really reduce the acne for sure. But sometimes, just depending on the severity, we do have to really take a look at hormones and think like, okay, is this something with your birth control? Is there a way we can get better hormonal balance for you? And then that's where it could require like dermatologic intervention with some like oral medications, hormone replacement, just whatever it might be. So it's just going to kind of depend on the person, but we can always help you figure out and kind of get to the root of the problem.
Yeah, I think that was a great distinguisher, because there are different types of acne, and just giving blanket advice would be really terrible, because if you were to say, hey, yeah, these acids are great, but then somebody has a certain type of acne that actually makes it worse, and then like vice versa. So I think it's really going to depend, and you definitely going to have like a multi-pronged approach with having the right provider, possibly getting hormones tested if you think that is the culprit, working on diet and lifestyle and stressors and sleep and hydration, all these types of things. So they all do go together. You can have the best skincare products in the world, but if you're eating like garbage and you're super stressed out and you sleep 4 hours a night, you're probably not going to have great skin, so
sleep is so important. And stress too.
Yeah.
Those cortisol spikes will literally cause breakouts like crazy. And so just something as simple as learning to manage your stress can help your skin, which I know sometimes is impossible. But that is something that can really cause acne. And then sleep is huge too. Like, if you're not sleeping, oh my gosh, that can definitely wreak havoc on your skin. Hydration, just getting down to the basics. Sometimes we forget, like we make it more complicated than it is. And if you really look at it and you're like, I'm not sleeping, I'm not eating right, I'm not drinking water, like start there, and then that's where, like even supplementation can help. Like, I have my patients get on First Form's greens a lot. Just gut health can tie into certain skin conditions. So just kind of looking at, I definitely like to take a little bit more of a holistic approach when it comes to acne. Definitely want to get you on products, but also want to kind of figure out like what's going on here and why are we getting this acne?
Exactly. So to pivot a little bit back to injectables, so Botox. I had somebody ask about the 11 lines, which are the kind of lines in between your eyebrows. Is there anything you can do besides Botox, or is that really the only thing we can do?
It's really the only injectable that I would do in that area is Botox for sure. When I started injecting back in the very beginning, I did sometimes use filler there. And it's funny because I hear this from a lot of injectors, but the longer I inject, like the less crazy things I want to do, because you just get smarter and you see, like, I'll go to a conference and watch the complications talk and I leave and I'm like, I'm never injecting again. It's too much for me. But this is a big danger zone, your glabella, when it comes to filler. So a lot of clients are like, just fill those in for me. And we really can't and shouldn't do that. And so most good providers are not going to do that. There was a picture circulating online like a year or two ago of like a newer injector who used, again, one of those permanent fillers in this area and like caused tissue necrosis. Like the poor patient like lost like so much of her forehead. This is very vascular, and we have vessels here that run to the eye. There's just some dangerous things that can happen if a filler were to make its way inside one of those blood vessels. So it's just not a good idea to ever put filler between your eyes in the glabella region here. But Botox is 100% safe, totally fine, totally great. And the thing is, unless those lines are like seriously like caves, like Botox will work. It just takes time and patience. Like,
unless you got the Grand Canyon in between.
Yeah, that's what I was looking for. It literally just takes time. So like I always tell patients, if you're coming in, okay, if you want to know if you're ready for Botox, look in the mirror and just keep your face rested. And if you see lines that are etched in and they're there when you're not expressing, then you know, okay, I'm ready for some Botox.
For sure.
And then I tell my patients, I'm like, okay, your first treatment, those etched in lines might not go away 100%. They're going to get a little bit softer. And then if you love this and we keep doing this every 3 to 4 months, after a few sessions, they will be gone. It's a slow work in progress. I always say, think of your skin as like a piece of paper. And if we have folded it so many times, it leaves a crease. So now with Botox, we relax the muscle underneath. So think of that piece of paper is like open now and it can't fold anymore. So over time, that crease is just going to continue to fall away. And so that's why you have to kind of stay on top of it. So if you do Botox and then you wait like 10 months, well, you're kind of starting over again. So you want to try, if you're really trying to erase a line that's bothering you, you kind of have to stay on top of it in the beginning, especially. And then once you kind of get where you want to be, you can probably do it a little less frequently.
All right. So somebody asked, this is kind of a specific question, but she's been getting Botox for like 13 years. Again, I don't know what the frequency is, how much, but a while.
Yeah.
And now she has vertical waves actually in her forehead. So not horizontal lines, but vertical waves. Is that something that's common? Like, why would that happen?
They're probably sleep lines. Her Botox is probably working and she doesn't have her expression lines, which are from like raising and frowning. And I just literally did my Botox last week. So it's so fresh. I'm like, let me try and make that face for you guys. So she's probably not getting her expression lines because her Botox is working, but she's starting to see vertical lines. So if you see vertical lines, like especially on the forehead, or we'll see them kind of on the cheek out here, use your hand, pretend it's a pillow, put it here and push on your face and look where those lines are. So night after night after night, those can actually start to stick in to the skin. So when I see vertical lines here, especially like certain patients, when they fold here, I'll know right away, oh, that's a sleep line. And I can just take my hand, apply a little pressure and see, yep, that's a sleep line. And then we can use a little filler in those. So, you know, the best answer is start sleeping on your back, but that's hard. I get it. So that's where you can use a little bit of filler and just kind of thread underneath them and give you a little support. Think of it as kind of like scaffolding to kind of support that tissue. But vertical lines are usually a sign of pressure or sleep.
All right. And then last Botox question, can Botox prevent future facelifts, or is there really no correlation? That's just obviously going to depend, or how much basically can consistent Botox use help as you age into maybe needing or not needing that?
Well, it's going to be largely genetic, honestly. Botox is going to help you age more graceful no matter what, but truly preventing a facelift, no, I wouldn't say, because the facelift is going to come from skin laxity. And as we age over time, and honestly, it starts happening in our 20s, our good fat pads in the face are atrophying and they're thinning out. And so when we're losing tissue, everything slowly starts dropping. So that's why later in life, we start seeing a lot of jowling down here and just heavier, loose skin. And that's where a facelift is going to come into play, when we can no longer sort of revolumize you with a little bit of filler. The skin has reached a point where it's really hanging. Maybe the neck is hanging a lot now too. And we really just need to kind of get in there and tighten that skin back up. So they'll make like a little incision behind the ear and just kind of tighten that skin back up there. So Botox really can't prevent that from happening. And that's just downright genetics. You know, some people are going to have a looser, heavier lower face and neck, and some people just aren't. And then there's always lifestyle and things like that too. But I definitely think Botox and filler can stave off surgery for many, and replace surgery for many. Like when we're talking about the under eye, if you're the perfect candidate for under eye filler, like that could replace the need for ever having to have a lower bleph. If you're the patient who has that huge fat pad, then you're going to want the lower bleph, where we can go back there, take that little fat pad out, and then you're done. So really just comes down to your anatomy and your genetics, but definitely sticking with a good skincare, a good maintenance routine of some injectables every few months, your skin will age so much more graceful.
Much better. What is I don't think it's a filler, but it's something that people get like under their jaw, and it's like dissolve. Is it to get rid of the fat? Is that a thing?
Yeah.
Am I making this up?
No, that's exactly right. There's a couple different things, but sounds like you're referring to Kybella, which is deoxycholic acid. And that is for reducing like a double chin. So it's going to be good for clients that actually have a lot of fat there. So most people aren't as good of a candidate as they think, because when I feel it, I'm like, oh, it's more skin and muscle for you. You know, you have to feel if it's actually fat. Yeah. If it is fat, Kybella can really help. And that deoxycholic acid will just kind of burn off that fat and reduce the bulkiness. It's kind of like a debulker. We can also use cool sculpting in that area, which cool sculpting is a non-invasive way to kill fat cells. And so it's freezing the fat cells to death. So we can do that like anywhere on the body, like tummy, thighs. And that's going to be good for people who are like, honestly, a lot of fitness people, because once you're close to your goal weight, but if you just have that like little stubborn area that won't budge, it's a really cool treatment where you can literally just target that specific area, freeze the tissue, and it kills off fat cells in that area. So we can do that under the chin too.
All right. Yeah. But so you're saying that a lot of people probably just skin, and that's not going to do anything. And that would need more of that kind of neck, yep. I guess, tighten up your neck.
Yeah.
Damn it.
Yeah. There's some things we can do, like for younger people, if you aren't a candidate for, you know, say this area bothers you and you're not obviously ready for a facelift by any means, and you're not, you know, a great candidate for, you know, Kybella or something like that. That's a lot of times where a little bit of jawline filler can be amazing. Put like a little filler in the jawline, just kind of crisps it up. It hides some of this. Maybe a little cheek filler to lift the cheeks just a touch. So there definitely are options that can help improve that area.
Okay. I had a question about calming psoriasis. So obviously that's going to be kind of like we talked about the acne, a little bit of a open-ended question. There's a lot of factors here, but is there anything in particular that you've seen that helps a lot? Or is it really just all over the place?
It's a little bit of both. It can be all over the place because it can just really depend on the severity of psoriasis. So psoriasis, again, is one of those sort of like autoimmune things where we don't, for some, know exactly what triggers it, but it's kind of figuring out like what are your triggers and really just trying to keep it controlled. That's the thing. With psoriasis, you kind of always have it, and the key is just to stop the flare-ups from happening. And so learning like what triggers your psoriasis, like what makes it worse, over time you can help prevent the flare-ups. But one thing I will say that kind of goes with what we're talking about is a lot of patients see improvement in their psoriasis over the summer because sunlight, even just like 5 to 10 minutes a day, can really help psoriasis. So, you know, just going outside on a little walk, getting your body, you know, wear your SPF and just get a little bit of sun exposure. And I mean, we were just talking about this, Laurin, that's just good for your soul anyways, but
a lot of good things.
Yeah, but that's really helpful for psoriasis. And then it just depends on how severe it is. If it's really mild, I mean, you could even try like the calming cream that I have, which has a little bit of hydrocortisone and aloe vera in it. But if it's more severe, then you probably need dermatologic intervention, and they're going to do some steroids and things like that. If you have it on the scalp, little trick is Selsum Blue shampoo. Trying that every other night can really help. But I do think like summertime is a good time to get a little sunlight and see if it helps keep it more dormant.
Perfect. And then so 2 more random miscellaneous questions. Jade or like other stone rollers. So somebody asked about that and I was like, what is that? Oh, the little, you freeze it and you roll it on your face. Like, does that do anything? Is it useless?
It's really hot right now. I feel like I've been seeing them everywhere. Okay. So I think they're good for the right thing. Like I've been seeing all these different like gua sha ones and like all kinds of, you know, stuff online. So for lymphatic drainage, I think it's great. So you could like keep them in the freezer, and that's gonna like cool them down and just help with like puffiness. And then you always just want to kind of like use them to like drain from like the center of your face out, like the forehead, like down. You're trying to like drain any kind of like toxins or excess fluid to the lymph nodes, essentially, is what you're doing. How wonderful does it work? I think it just like totally depends. Some people are like just blown away and thinks it like depuffs their whole face. And then other people are like, I don't know, I can't really tell. So I think you could just try it. One thing is for sure, it's not harmful at all. Like you can totally give it a try. it's just one of those things that can help like depuff you. But I have been seeing it lately because it's so hot. Like some people, this always happens in our industry, like a lot of smoke and mirrors, like people market things and they're like, oh, this is just going to replace a facelift or whatever. I'm like, absolutely not. Like that will do nothing at all. Like,
this $10 jade roller will totally knock out facelifts forever.
Yeah. I'm like, no. Can't replace your injections. Doesn't do anything like that. But if you want to try it for just like lymphatic drainage, absolutely give it a try. The only thing I tell my patients not to do is I'm not a fan of those at home, like derma rollers with the little needles on them, because they are just like superficial. They're 0.02 millimeters. They're not even breaking the dermis. So you're getting no real medical benefit from it. And in fact, like most of the time you're only causing like a little injury, irritation, bacteria spread. They're just not a good thing. So I don't recommend those.
Yeah, that sounds super sketchy. And the last question, which this has been super hot, I've been seeing a ton too, is threading.
Yeah.
So my main question, I guess, well, one, just curious about your thoughts on it. Where do you think it's the most beneficial? But then who do you need to go see for this? Because I've been seeing it pop up a lot. I've been hearing people talk about it. And it very much sounds like, to me, like the filler and Botox explosion, right? Where a lot of people are just kind of doing this on the side and, they may or may not be the most qualified. So like if you want to get threading, I guess explain what it is, where you think it's best, and then where people should go to get it done or who they should go get it done from.
Yeah, this is super controversial in my industry right now. And like there's providers on both sides of the fence. I have provider friends that like are living and dying for threads right now. And then I have other ones that like hate them. So I actually, the plastic surgeon that I work for, we have a course, it's called Med Spa Mastery. And we round up key opinion leaders in our entire industry from all over the country, all over the world even. And we speak on different expert panels and we talk on different things. And we, every course we have one on thread lifts, and we call it literally thread lifts. Let's argue, because everybody like wants to say they're great or they hate them or whatever. And if you're drinking the thread lift Kool-Aid, they're really drinking it. So I'm more on the side. I'm not a huge fan of them. I think in the right situation, they can be okay. But my personal opinion is I can do the very same things with filler that I could do with threads. Filler is safer, more predictable, reversible. So I just feel like I don't personally have a need for threads in my practice. But maybe for the right patient, for the right thing, it could be for you. So threads are going to be a dissolvable suture where they are going to be used mostly to lift. So lifting the cheeks a little bit. There's a really hot trend going where some people are doing this like fox eye lift where they're like lifting the brow really high. I don't recommend that. The problem with threads are if they are not placed properly, they can cause some pain and they can kind of pop out and hurt the cheek. And then really you can get into trouble because it's like you almost need to like get in there to get them out, or you wait for them to get dissolved. So if I were going to do threads, I would definitely go to someone who does a ton of them. And if you need help with that, you can feel free to DM me or email me. I do have some amazingly talented friends all over the country and some that do offer this. And my friends that really like it, I seem to see them use it in conjunction with filler. It's never like, oh, we're not going to do filler anymore. We're just going to start doing threads. It's like they've achieved what they can with filler and they're going to try for a little extra pop or something with some threads. But threads are going to be semi-permanent. They last only like, I think they say most people like a year. But here's the deal. When you look on Instagram and things like that, you just have to be really careful because what can be so misleading, especially in our industry, and you probably see this a lot in the fitness industry too, is some people are just not super, I guess, ethical with their before and afters because they'll post a before and then they'll post the after with the thread literally 10 minutes after it was placed. So the thread looks like it's like giving all this height. Well, as soon as the swelling goes down and the thread settles, that is going to go away. It's not really that dramatic. And so I never see pictures of before and after threads where it's like before and then a few weeks or a few months later. It's like before and then 5 minutes later. And so that's just not realistic. So then you get patients coming in like thinking this is the result they're getting, but that's not how it really is. So you just have to be a little bit careful with them.
Yeah, I thought that they lasted much longer. The fact that it only lasts about a year, and you're saying that you can pretty much get the same result with filler, that just seems like a much safer route. especially because, again, if something, not saying that filler doesn't have its complications, but you could always reverse that, right? Whereas like reversing the threads might be a little bit more of a challenge, a little more invasive, I guess, at least. Nonetheless, it's more invasive. So
Yeah. Yeah, I think it's like one of those things where it would just, depend on the person, depend on your anatomy, depend on your goals, and then just make sure you go to somebody who, is very well versed in threads. So, and there are people out there who are, so just making
would
sure.
that be somebody like with your credentials, or would that be a plastic surgeon?
A plastic surgeon or a nurse injector, nurse practitioner, physician associate, and really looking at the experience. So you just want to make sure that they've been doing them for a while and that they do a high volume of them.
Okay, perfect. Well, I think that was all of the questions. You killed it as usual. If people do want to reach out to you, whether it's for a complimentary skincare consult or anything, where should they go?
You can go to my beauty blog. It is www.racquelfrisella.com. You can also find that on my Instagram, which is Racquel Frisella, in the link in the bio. It'll take you to my beauty blog. But I do have a page where you can submit for a complimentary skin consultation, where I'll just kind of take a look at your skin and I can put together a little customized skincare plan for you and just show you all of your options. And I can ship all over the US, which is awesome. And then I do see patients here in St. Louis. And I do have patients that fly in, and we just kind of plan that ahead of time. So
awesome. Well, thank you again. I really, really appreciate it. If you guys have questions for Racquel, you can reach out to her that way. If you have any questions for me or for the team, you can visit teamlocofit.com, and we will talk to you guys next week.
thank you so much for having me.
Of course, we'd love to have you back.